Well, did you know melanoma is the most common form of cancer for young adults ages 25 to 29 years old, and the second most common form of cancer for adolescents and young adults ages 15 to 29 years old? Of course, this is according to the American Melanoma Foundation. So, what do we need to do to keep our skin healthy? Well, joining us now is Dr. Brenda Letowski, who is a dermatologist, and Brittany Kochnick, who's with the Arizona Science Center, and also you've actually dealt with skin cancer. So here's the question I want to ask Dr. Letowski. Ladies, first of all, thank you so much for joining us.
Thank you.
I appreciate
Thank you
that.
for having us.
So what are some of the signs, well, first explain to me, what exactly is melanoma versus skin cancer? What's the difference? Because I always thought there was one and the same.
So melanoma is a type of skin cancer, and it happens to be one of the most deadly types. So that's one that we often worry about. However, it's very treatable if it's caught early, and that's why it's so important to have these skin cancer screenings.
Okay. Well, what are some of the signs that people can look for to know if maybe they should go to a doctor or not?
So there's a mnemonic we use that's actually very simple that helps patients remember warning signs of melanoma. It's called the ABCDEs of melanoma.
Okay. ABCDE.
Exactly.
Okay.
So A is for asymmetry. So if something is one half of something does not look exactly like the other half.
Right.
B is for borders. So irregular borders can be a warning sign. C is for color. Anytime you have more than one color in a mole, it can be a warning sign.
Okay.
And D is for diameter. So anything greater than a pencil eraser, we want to keep an eye on. And finally, E is the most important one, and that's for evolution or change. So if someone has a changing mole, they should be evaluated by a dermatologist.
Okay, well that was pretty simple, A, B, C, D, E. Okay. Well, Brittany, now you were diagnosed with skin cancer, not melanoma. So how did you know that you had skin cancer to begin with? You're so young.
And actually, I was diagnosed twice with skin cancer before the age of 30.
Wow.
So, as Dr. Letowski said, there are the warning signs for skin cancer, and people should know their bodies really well and perform skin checks. You just know when something isn't right.
Yes, and I see that we have a picture there. Now, this was before or after you were treated?
That was right after my surgery to remove the basal cell skin cancer from my upper lip.
Okay. What changed in your face that made you feel like you need to get this checked out?
There was a little white spot, and at first I thought it was a pimple, but it didn't go away and it kept evolving.
Wow.
So it just kept staying, and I thought, well, this isn't right, I need to have it checked out.
Okay, and what did they do to treat it? They went in and removed it?
They did a biopsy, found out it was basal cell, and then they had to go in and actually cut out a section of my flesh to make sure the margins of flesh around it were clear and that the skin cancer hadn't spread.
Okay. Well, now, Dr. Letowski, what are some things that we can do? Because we live in Arizona. It is sunny 300 days out of the year. So what are some things that we can be proactive in doing to prevent from getting melanoma or skin cancer?
Well, you're exactly right. We can't avoid the sun here in Arizona. So just some common sense things like wearing a wide-brimmed hat when we're out running errands, wearing sunscreen, of course, and avoiding the sun when it's at its strongest between the hours of 10 and 5.
Okay. 10 and 5 when it's the strongest. That's pretty much is kind of all day, sort of, in a way.
Pretty much.
Okay, well, Brittany, I know that the Arizona Science Center is actually doing something with melanoma on Monday. You guys are doing a free screening. Tell me about this.
Yes, Arizona Science Center and Body Worlds in the Brain is hosting Melanoma Monday on Monday, May 2nd. It's going to be from 10 a.m. to 4 p.m. We're going to have live UV awareness activities and demonstrations. We'll have free skin screenings with Dr. Letowski. And we'll have information from the Skin Cancer Foundation, American Cancer Society, and it will be free with general admission.
Okay, and also Body Worlds, you actually have samples of the skin that has melanoma.
Absolutely. Body Worlds in the Brain does have a transparent body slice that features the metastases of melanoma.
Okay. Well, ladies, thank you so much. And Brittany, stay out of that sun and wear that sunscreen.
Absolutely.
But we'll have more information of the details of this free screening on our website. Just go to abc15.com and click on the Lifestyle tab.